I'm Dr. Georgie Siggers. I'm a consultant community paediatrician, and I'm currently the interim designated doctor for the Kent CCGs for looked after children. And back in October 2015, I was actually working as a consultant community paediatrician with a responsibility for looked after children and as designated doctor for Kent Community Health Foundation. The trust that I worked for hadn't had responsibility for undertaking initial health assessments for unaccompanied asylum-seeking children because that work had been commissioned from a local GP practice who were seeing small numbers. But in the summer of 2015, we had a massive influx of young asylum-seeking children and young people. We then heard about the national transfer scheme, and at that stage it was very unsure what we would do about initial health assessments because there was no way with our capacity that we could turn around a holistic, comprehensive initial health assessment in 5 working days. So I was then responsible for developing what we termed a fitness to transfer medical model, and really the thinking behind that was that we knew that some of these young people were arriving with quite significant health needs. One of my real worries were that we could potentially transfer a young person who had a significant health issue to an area that would perhaps be under exactly the same pressure that Kent had been in terms of being able to undertake initial health assessments within statutory timescales. And a young person could sort of pitch up in someone's clinic really unwell, and that team may not know anything about them. And I was worried, how that would be for young people, but also for the team receiving them, that it would be very irresponsible and would then mean that people's sort of view of accepting unaccompanied asylum-seeking children into their area would maybe be coloured in a very negative way, whereas actually our experience isn't that isn't the case, but there are things that if you can detect early and you can plan, just means it's much safer for young people and for the teams that are working with them. We've set up a traffic light model for considering the needs and whether young people can move straight away. So if they're termed, if the traffic light is red, then that means stop, we have to do something now before these young people can move. If they're amber, it means that they're okay to move, but there will be some immediate attention needed from health when they arrive in their new area, and green is the green light to be transferred. And we've developed an assessment form for the fitness to transfer and a clinical guidance that goes with it for the nurses. And then what we do is once young people have been seen and a report has been produced, we hand that on to the new health teams, usually via the social worker, but if they're considered to be amber, then we would have a health-to-health conversation about what's needed. For young people who have been deemed status red, they have a review of their status before they're moved, because obviously we need to make sure that whatever condition had meant they couldn't move has been addressed and they're now safe to travel. So they then are reassessed, and they're always considered amber because there will always be some health information that needs to be handed on and an action associated with that. There's so much learning that can be gained from talking to your colleagues about this work, and I've just found in this particular area of work that's been more apparent than I've experienced in other areas, but it's been very powerful to have good clinical supervision. Working with these young people has been such a privilege. When I started out in this area of work, my son was 16, and I couldn't fail to sort of make the connection and think about him and how he would manage, and that sort of awareness, I guess, that they're 16 and they might look like adults and they actually might come across like adults, but they're not. They're so vulnerable, and they need their parents, and they're all on their own. And it's so important that we respond in the right way.